Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Hi, yes indeed, this is Jerry Hickey, nutritional pharmacist. I'm also the chief scientific officer over here at Invite Health, and today's episode deals with SAMe for depression. Now, SAMe is something that we naturally make in the human body. Our highest concentrations are in our liver and our brain. SAMe is the accepted abbreviation for the nutrient S-Adenomethionine. Recently I did an episode on SAMe for joint pain, for arthritic pain in the knee. It's very successful for that. In any event, taking extra SAMe can be utilized for helping depression, especially treatment-resistant depression. So let's go into that. SAMe does a bundle of things in the human brain. It has an anti-inflammatory effect because it raises the level of a very key antioxidant called glutathione. Now, the level of glutathione varies dramatically from person to person. It can vary as much as 50% according to some data. Glutathione breaks down peroxides. So what's the significance of that in the brain? Well, the brain is a super high energy organ. There's a great deal of circulation to the brain. That's to carry all the calories from your food to the brain so you can use that for energy. In fact, it's thought that your brain takes 20% of all the calorie content of each meal. Yet your brain is only 2% of the dry weight of your body. So as a byproduct of using sugar for energy, the cell releases peroxides. There's peroxides released right within the cell, which could damage and destroy the cell. So the body has to be equipped with ways of snuffing out the peroxides, and it does this by releasing glutathione peroxidase, which breaks down the peroxides. Now, glutathione levels drop with age, so that's a nice side benefit of taking some SAMe. And a little bit of SAMe is not a bad idea to take, like an older person taking 200 milligram capsule each day is not a bad idea. SAMe has to be enteric coated. What that means is there's an additional coating. And the reason for that is to get past the stomach acids and the intestinal enzymes, because these can deactivate SAMe. They could break down SAMe. So when they enteric coat it, it gets down to the colon, it breaks apart there, and it's utilizable. Now, besides SAMe helping restore antioxidant levels to the brain to help prevent free radical damage in the brain, working as an antioxidant, SAMe creates key neurotransmitters. We know of about 100 neurotransmitters in the brain. Some of them are needed for energy, some of them are needed for sleep, some of them are needed for the immune system. But there's 4 key neurotransmitters that SAMe is involved with that we know of. One is serotonin. When you're eating food, you create serotonin to help control your appetite so you don't continuously eat, so you get satisfied with the amount of food you're eating. But serotonin is also involved with breaking down depression and anxiety, and it's a solution for stress. Now, SAMe also at night creates melatonin. Melatonin is needed for sleep. Melatonin is needed for a healthy digestive tract. It's a great anti-inflammatory in the digestive tract. But melatonin also helps reactivate an aging immune system. With age, our immune system goes through immunosenescence. It doesn't work as well. It's harder for our immune system to protect us from viruses and bacteria, and melatonin helps bring that back. SAMe also is converted into dopamine. Dopamine helps you decide what's right and wrong. It's kind of like good for pleasure. And it creates norepinephrine, which helps you focus and pay attention to things. So SAMe makes these key neurotransmitters that make your brain work appropriately. So there's an arm of the government, it's within the Department of Health and Human Services, called the Agency for Healthcare Research and Quality. And what they do, they collate evidence on things so that different organizations and agencies can base clinical guidelines on the information that they collate. So they looked at SAMe and depression. They said that depression affects approximately 15 million Americans each year in any given year. The annual cost for treatment is about $50 billion. So, and there's also a lot of lost work time. So it's not just expensive for the patient, it's expensive for the company they work for. Now, let's look at the data. They have 28 human clinical trials in their meta-analysis. So let's explain what a meta-analysis is. A meta-analysis tells you if something either works or it doesn't work, if they do it correctly. Now, they look through 25 biomedical databases to search for these 28 trials. So a meta-analysis, if they're using good data, good studies, well-performed studies that are reported accurately, and there's a lack of bias, it really tells you if something works or it doesn't work. So in 28 human clinical trials, SAMI worked. SAMI improved the Hamilton Rating Scale for depression. The Hamilton Rating Scale for depression is a questionnaire that helps doctors judge how severe depression is, to guide their treatment, to see if there's recovery, to gauge recovery. So in adults, because it's used in adults, it probes their mood, their feelings of guilt, suicidal ideation. Suicidal ideation means were they ever thinking of suicide? Things like insomnia, agitation, etc. And here's what they found. That SAMI absolutely improved the Hamilton Rating Scale for depression. That's significant. And they said it was statistically significant and clinically significant. In other words, it was truly meaningful. Now, here's what else they said. Compared to treatment with conventional antidepressant pharmacology, so that's prescription antidepressants, treatment with SAMI, here's how they say it. They say it kind of backwards. Treatment with SAMI was not associated with a statistically significant difference in outcomes. In other words, it worked as well as the antidepressants. That's what they're saying. They're just a weird way. Researchers sometimes have peculiar ways of expressing things. So here's the Journal of Clinical Psychiatry. And it's a review of SAMI for clinicians, for neurologists, for psychiatrists, for psychologists. It's the Department of Psychiatry, University of Pennsylvania School of Medicine, top-notch academic research institution. The Department of Psychiatry, New York Medical College, that would be up in Valhalla. I used to live near there. It's beautiful up there. Baylor Research Institute in Dallas. The Department of Psychiatry, Michigan State University, Brown University Department of Psychiatry, the Department of Psychiatry, UCLA, Columbia University Medical Center, and the Department of Psychiatry, Harvard Medical School in Boston. So just to let you know that the academic research institutions involved with this review know what they're talking about. You have 3 Ivy League universities there. So they included 115 human clinical trials in this review. 115 human clinical trials. They found promising evidence of the efficacy and safety. Now I'm going to paraphrase. Promising evidence for the efficacy means it works, and safety means, hey, it's safe. Using it as monotherapy, so using SAMI alone for depression, or as an augmentation for other antidepressants. In other words, it's safe to add to other antidepressants. The problem is you really need to discuss this with your medical doctor if you're already on an antidepressant before adding it. So here's the American Journal of Psychiatry. It's the Center for Treatment-Resistant Depression. Sometimes they give drugs for depression and they're not working. It's Massachusetts General Hospital and also Harvard Medical School. So they're adding the SAMI to SSRI drugs. They're adding SAMI to SSRI drugs to see if it will help them, to see if it'll help work better, because they're not able to help these people with their major depressive disorder. So it's 73 patients on SSRIs, but they're not responding to it. They're still depressed. They have major depressive disorder. And they tried to give 800 milligrams of SAMI twice a day because the dosage in SAMI varies from person to person. They stayed on the same dose of the SSRI, and SSRI, there's a whole bunch of them, Paxil, Prozac, Surzone. So they found that if they added SAMI to the drug in patients where the drug was not working, hey, the drug started to work. It was far superior to placebo. So here's CNS Neurological Disorders and Drug Targets. That's the name of the journal. It's the Department of Mental Health over in Italy, in Teramo, Italy, the Department of Mental Health in their G. Mazzini Hospital over there. And they're looking at a review. Does SAMI work in major depressive disorder or in people with major depressive disorder where the drugs are not working? This is an important review. So here's what they found. Several randomized controlled human clinical trials. SAMI has antidepressant activity. Using it alone, it works. But also adding it to tricyclic antidepressants. Now that's strong. Tricyclic antidepressants are stronger than the current commonly used antidepressants. The problem is tricyclic antidepressants have a lot more side effects. So tricyclic antidepressants are drugs like Elavil, amitriptyline, nortriptyline. So they found that in people where SSRIs, okay, so first of all, they found that SAMI can work better than tricyclic antidepressants, which is very interesting because tricyclic antidepressants work really well, but they have a lot of side effects, and SAMI is very safe. They find that SAMI is safer than placebo in a lot of these studies. Why would SAMI be safer than placebo? Because it makes you feel good, because it raises antioxidant levels and you feel better. So it's actually better than the placebo. So they found that in patients where SSRIs are not working, SSRIs, once again, are Zoloft, Celexa, Lexapro, Prozac, Paxil. There's a whole bunch of them. That adding SAMI helps them work. And in patients where serotonin, norepinephrine, reuptake inhibitors aren't working. Now, that's really important. Those drugs would be Effexor, Cymbalta. They're stronger than the Prozac and Paxil and Lexapro and Celexa and Zoloft. They're stronger than them. So if you're not responding to those drugs, it's a problem because they raise not just serotonin but norepinephrine, both of which are useful for helping to treat depression and anxiety, that if you added SAMI, it helped the drugs work. So let's see what they say in their conclusion. Overall, SAMI is a well-tolerated medication which may offer considerable advantages as an alternative to antidepressant drugs or as add-on therapy, in other words, adding it to the already established treatment for depression and major depressive disorder or treatment-resistant major depressive disorder. SAMI is really something to use. I mean, so here's the American Journal of Psychiatry. It's the Center for Treatment-Resistant Depression, Harvard Medical School. Well, there's no point in reading this. I mean, it's basically the same thing. Well, let me go into it. 73 patients on SSRIs with major depressive disorder, but the drug wasn't working. Whatever drug it was, Paxil, Prozac, Surzone, whatever it wasn't working. They added SAMI, or they added placebo. Now, the patients stayed on the drug, but they found that 50% more patients responded to the drug if they added SAMI to the drug. That's really impressive. There are certain supplements that really help with depression. Alcar, which is acetyl L-carnitine, really helps with depression. It's safe to add on to antidepressants, but once again, it's your duty to mention that you're going to use it to your doctor before you add it on. You have to get their okay on it. Another one is a well-absorbed turmeric called Bio-Curcumin. There's 5 human clinical trials. It really helps depression, and when they add it to drugs like Paxil and Prozac, it helps them work better if they weren't working in the first place. So in this case, in patients who were on the drugs for depression and they weren't working, according to Harvard Medical School, if they added SAMI, 50% more patients were responding to the drugs finally. Now here's one, because let's go across the pond. Let's go across the Atlantic. This is the psychiatry department at Tel Aviv University. It's the Journal of Affective Disorders. Same thing. Patients on antidepressive drugs, major depressive disorder, and the drugs weren't working. They're called non-responders. They added SAMI, and SAMI was working. And it was helping them with the cognitive symptoms. When you have major depressive disorder, your brain doesn't work well, and it affects your memory, like remembering words, etc. When they added SAMe, not only was it good for the depression, but it was good for the cognitive symptoms of major depressive disorder. It was helping bring back their memory. Now, I have more. I don't know if there's any point to, they're all the same thing. Basically, SAMe on its own can be used safely for depression. The dosage is going to vary from person to person. Generally, it's from 800 to 1600 milligrams a day. It could be added to certain drugs if they're not working for people with major depression. They're called non-responders. But once again, you have to mention that to your doctor. Now, a take-home is for a person like me, 66 years old. I'm an older guy. If I add a little bit of SAMe just to my daily supplement regimen, it's good for my liver. It's good for my joints. It's good for my brain. It's an anti-inflammatory, antioxidant. I'm not using it for depression. I'm like an incurable optimist. You know, my glass is always half full. It's never half empty. So I don't get depressed. But the SAMe for me helps restore antioxidant levels in my brain, and that can only be a good thing, and antioxidant levels in my liver. So thank you. So if you're older, hey, you could do 200 milligram a day with your breakfast just to do better. Now, thank you for tuning in to the Invite Health Podcast. You can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Please subscribe. Please leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. Now, before signing off, let me give you an email address that goes directly to 5 of my nutritionists. This way, if you have a question about anything I said on this episode or any health-related question about nutrition, your diet, supplements in general, here's the email address. I'll give it twice. nutrition@invitehealth.com. nutrition@invitehealth.com. So, thank you for listening. I hope to see you next time on another episode of the Invite Health Podcast. Have a good day.